Now, in terms of drug use, right, you obviously were aware, based on the toxicology, that Mr. Flyod had certain drugs in his system, right?
Yes.
And so when we say on board, that means in the system.
Yes.
Would you describe the use as you know, based on the information that you have, as sort of a binge use of drugs?
Oh, I guess I couldn't answer that.
Are you familiar with drug use taken or used rectally?
I've heard of that, yes.
And that increases or speeds up the distribution of controlled substances in a person?
It speeds up absorption, yes.
Okay. So the effects would be felt much faster?
Yes, they could.
In a case where you have a person who is experiencing cardiac arrest, right, and they're put in an ambulance and taken to the hospital for resuscitation, there's IVs that are placed in a person, right?
Yes.
And those IVs contain saline.
Yes.
And saline can ultimately dilute or decrease, to some degree, the amount of controlled substances that would be as they would be measured.
That's a theoretical possibility.
You'd agree that fentanyl is a respiratory depressant, right?
Yes.
It slows breathing and lowers oxygen in the blood.
Yes.
Does the fact that there's norfentanyl in his blood mean that he took it some time ago?
Yes, but by some time, that's a very vague, yeah.
So long enough in the past to start metabolizing.
Exactly.
But does it exclude him taking fentanyl more acutely or more recently in time?
No. There's no way really of knowing the timing.
Fentanyl depressing the respiratory system can also act with the coronary artery or can interact with coronary vessel disease, correct?
Can you clarify that?
Sure.
I'm sorry.
Does fentanyl's depression of the respiratory system also act with coronary artery vessel disease and oxygen and carbon dioxide to reduce the supply of its supply to the heart?
Oh, so as fentanyl may lead to a gradual progression of slowing breathing and ultimately decrease the oxygen, that would apply to oxygen to the brain as well as to the heart. Is that what you're, yeah.
And it would likewise increase the carbon dioxide in the blood.
Yeah, I mean anything that decreases respiration decreases that exchange.
Right. Mm-hmm. So as that exchange process is happening, right, you're not taking in the oxygen, you're likewise not expelling the carbon dioxide, right?
Right.
And thus the carbon dioxide will increase because you're not expelling it, right?
Correct.
You would agree that methamphetamine is a stimulant, right?
Correct.
And that can cause a cardiac arrhythmia?
It can.
And it can increase a person's heart rate?
It can or cannot.
And you testified before that methamphetamine, there's no safe level of methamphetamine, right?
Correct.
So the fact that methamphetamine is at a lower toxicological standard doesn't somehow make it safe.
Right.
It doesn't exclude the possibility that it could increase the heart rate.
It could or not.
In terms of the evidence in this case, were you made aware that drugs were found in the backseat of the squad car?
Yes.
and that those drugs contained the DNA of Mr. Floyd,
Yes.
and that those drugs were at least to some degree partially dissolved,
Yes.
and that those drugs were fentanyl, a mixture of fentanyl and methamphetamine.
Yes.
Based on the toxicology in this case, did you see any metabolic byproduct of methamphetamine?
No.
And so that means that the methamphetamine was taken more acutely or recently in time.
Probably. I mean, there's lots of variables.
So again, just kind of taking into consideration removing certain variables, right? You find a person at home, no struggle with the police, right? And the person doesn't have a heart problem, but you find fentanyl and methamphetamine in this person's system at the levels that they are at. Would you certify this as an overdose?
Again, in the absence of any of these other realities, yes, I could consider that to be an overdose.
And the level of fentanyl in a person, again, in this hypothetical scenario, there are deaths certified as drug overdoses significantly lower than 11 nanograms per milliliter.
Lower, higher, it's got a huge range, yes.
As low, I believe, as 3%, or 3 nanograms per milliliter.
Yes.
Right. So the ingestion of drugs is unique to that individual's body, right?
Right.